Hey everybody, welcome to our regular scheduled research updates of pertinence to lipedema. I hang out with you twice a month on Thursdays, usually the first and third Thursday of the month. And so I have a really good paper that I want to talk to you about today. But I would like to remind you that I love to know when people are out here listening to it live, and many people enjoy this in the replay. But if you're here with me right now, put something in the chat. Say hi, say where you're from, maybe what the weather's doing where you are. I'm in Southern California, and I think it's like in the low 70s here right now. Beautiful sunny day with not a cloud in the sky. So let me know how it is where you are in the world, and be sure if you have any comments about the paper I'm talking about, or if you just like to make some comment about lipedema in general, be sure and put that in there. This is a paper that came to me as a suggestion by one of our listeners. So be sure and send me if you have a paper you want me to review and go through. Definitely send that off to me. I'll really quickly give you my email, and we'll do it again later also. But you can send any papers or questions or comments to Leslyn@lipedemaproject.org. And love to hear from you, and I'd like your suggestions. So the paper we're going to talk about today, the title of the paper is, "Are there other hormones connected to lipedema besides estrogen? Clinical experience and preliminary findings." So this is by a group of practitioners, clinicians in Italy. That this is not an official study or anything, but they are showing you what they've seemed to find true, what their experience is with their patients. And they're starting to formulate some hypotheses about lipedema because of what they're seeing in their clinics. And so, again, not a formal study, more like an expert opinion piece. And, that we're always looking at the impact of hormones on lipedema. So this was a paper that was definitely of interest to me. So we'll give you the link to the paper in the comments down below. But feel free to contact me if you have any difficulty getting this paper, if you'd like to read the whole thing yourself. It's not that long. It's like only about 4 or 5 pages long. So it's not that long and very readable. So do get that paper yourself and read it. So it was published in, Advances in Public Health, Community, and Tropical Medicine, interesting, in July of 2023. And so their hypothesis of this group of clinicians in Italy is that there may be other hormones that are important to the onset or exacerbation of lipedema symptoms. There's now pretty compelling evidence that fat tissue actually acts as an endocrine organ, meaning it emits hormones, and it's very involved in all kinds of bodily functions through the secretion of those hormones. And many of these hormones may have a significant impact on lipedema. And so the author suggests that theoretically all hormone systems can have an impact on the growth and metabolic function of adipose tissue, and thus it can then have an impact on lipedema. They believe that we really need to explore both the endocrine and metabolic profile of each patient to make sure that we're giving them the best help we can. So why is this of interest? Well, treatment can better be individualized for each person with lipedema. And if we understand whatever endocrine or metabolic dysfunction they have, and if we understand the impacts of various hormones have on lipedema symptoms. So I'm going to talk first about, and they talk in the paper first about estrogens and sex hormones and their impact on lipedema, because this is pretty much the one that everybody goes to. It seems very logical that these estrogens and other sex hormones have an impact on lipedema. So sex hormones, they change in a woman's life at puberty with contraceptive use, if there are hormonal contraceptives, and pregnancy and menopause. And these seem to correlate with times that lipedema either starts or it gets worse. So it seems pretty logical to think that estrogen has some sort of impact on lipedema. But it also has, these sex hormones also have other impacts that would influence the start or the worsening of lipedema. And one is that sex hormones direct where fat gets deposited on your body, and it has different directives for males versus females. So women in general, starting at puberty, they have more subcutaneous fat. Now that fat just right under your skin throughout their body, they have more starting at puberty than males do. Males don't get all that subcutaneous fat. And then also females have fat get through the influence of estrogens and other sex hormones. It gets directed towards the lower body. Doesn't necessarily cause that really asymmetrical, uneven distribution to the lower body like we see in lipedema, but it definitely, it sends more to the lower body. So then you get the curvier hips and stuff like that for females than you have for males. And so it would seem like this natural influence of fat to go to this place in the body for females directed by estrogen, that may have some kind of influence by getting that really exaggerated appearance in the lower body in lipedema. They also said that, these sex hormones also have quite an influence on the blood vascular system. And they seem to have also this influence during these time periods that we were talking about, with puberty, using hormonal contraceptives, pregnancy, and menopause. For instance, estrogen and progesterone cause changes in the dilation of blood vessels during menstruation and during pregnancy. So, and these are times that we could have a worsening of symptoms of lipedema. So there might be some association there. So these are some of the ways that estrogen can influence lipedema. But let's look at some of these other hormones that they discuss in this paper. And the first is insulin. I think many of you have heard of insulin. It's talked about in the way of, if you eat carbohydrates or sugar, then you have insulin that helps you take care of that. But insulin actually has a lot of jobs. Part of it is, yes, in glucose metabolism, but it's also involved in other stuff too. But what they talk about in this paper is that pathological changes in glucose metabolism is one of the first things that we should be looking at our patients with lipedema. Is there some change in that glucose metabolism? And and one of these pathological changes that we would notice would be insulin resistance. So that the body's tissues that are resistant to the signals that insulin is trying to give them, and it can lead to fat gain. And they noted that they did not have never diagnosed a patient with actual diabetes, but they have diagnosed quite a few of their patients with lipedema with insulin resistance. And I'm just looking for the percentage, 30% of their patients with insulin resistance. And commonly, insulin resistance can be referred to as pre-diabetes, kind of you're on the road to diabetes. And they said this was related to the stage of lipedema, that they had a higher incidence actually with stage 3 lipedema. 50% had insulin resistance. And I want to just point out right here that this is different numbers than one of our colleagues, Dr. Gabrielle Ferber, has in her clinic in Germany, where she works with patients with lipedema. And she does what's called the HOMA-IR blood test that looks at, it's a calculation based on, I think it's a relationship between glucose and something else, but it tells you if the person has insulin resistance or not. And her patients do not. Her patients with lipedema do not have insulin resistance. But yet in this clinic in Italy, they noticed significant insulin resistance in their patients. But let's look also at other influences, let's see, that associated with altered glucose metabolism and insulin. They talked about menstrual irregularities. 15% of their patients had menstrual difficulties, and 30% had polycystic ovary syndrome, which this is associated with altered glucose metabolism. So insulin could be affected in that area too. So you're looking at not only does the person have insulin resistance, but what other comorbidities do they have? Are they having troubles with their menstruation, or do they have PCOS? These need to all come into when you're looking at their metabolic and their endocrine profile. Another one that they talked about that hasn't been mentioned so much in the literature, this is really interesting, hypercortisolism. So high cortisol, how interesting. And this, for me, this is interesting because we have talked about before, this is anecdotal only, there's nothing written in the literature, but high stress, periods of high stress, for some people, they talk about how that correlates with their lipedema symptoms getting worse. And what is the hormone that gets emitted with stress? Cortisol. And there is actually a condition called with high cortisol, and that's called Cushing's disease. And they noticed that they have not actually diagnosed any of their patients with Cushing's disease, but they noticed a couple of patterns that with cortisol and lipedema. This is very interesting. One that they noticed was that if a patient had to have cortisone or cortisol treatments for something, for instance, like cortisol injection because of knee pain or something like that, that the patient would report that their symptoms got worse with that cortisone treatments. Very interesting. And they also had several patients that they had diagnosed with lipedema, and that patient in their medical history said that they previously had Cushing's syndrome. Interesting. And then there is a lot of symptom overlap between Cushing's syndrome, high cortisol, and lipedema. And so let's look at some of those. Easy bruising, pain, fatigue, sudden weight gain. These are the ones that they noted in that symptom overlap in this clinic in Italy. I looked up other symptoms of Cushing's syndrome that could be, seem to have an overlap with our patients with lipedema. Other symptoms are trouble sleeping, depression, anxiety, irritability, difficulty concentrating or remembering things. This is not necessarily listed as symptoms of lipedema, but many patients with lipedema talk about having these issues. So I think this is something we need to be looking at cortisol is something we need to be looking at with lipedema, and possibly, some more research in that. They also said an interesting thing that they noted in their clinic is that a main, almost like classic symptom of Cushing's disease is a hump just behind your neck on your upper back. Okay. And in their clinic, they have seen patients, especially when they have upper arm involvement or arm involvement with their lipedema, they have that hump. And so another overlap in those symptoms with high cortisol. So really interesting, and I hope that more research is done in this area. Another hormone that they were looking at was thyroid. How was this involved? And in a paper that we have done about using a ketogenic diet, we did talk about thyroid extensively because it's a very common comorbidity. Low thyroid is a common comorbidity with lipedema. And in this clinic in Italy, they said about 30% of their cases had hypothyroidism. But there is two types of hypothyroidism they talked about. One is what's called primary hypothyroidism. And this was most often in their patients who did not have obesity associated with their lipedema. So they had primary hypothyroidism, but the other one was autoimmune. And it's the autoimmune type of hypothyroidism is called autoimmune thyroiditis. So that was more associated with their patients with lipedema who also had obesity. And so about a third of their cases of patients who had hypothyroidism had autoimmune thyroiditis. And it's very commonly associated with obesity, but we're also seeing in many papers, it's a common comorbidity of lipedema. And so they talked about a proposed explanation of why this would be the case is that endocrine functions of fat tissue, when they're dysfunctional, as they are in lipedema, it produces several hormones that may not be at the appropriate levels. So you can have leptin, adiponectin, numerous cytokines, and this could be something that is implicated in that autoimmune thyroiditis. So dysfunctional fat tissue, lipedema, dysfunctional fat tissue, autoimmune thyroiditis. So not sure exactly what the connections are, but there seems to be an association. They also talked about vitamin D, which if you really look at it, it's actually a hormone. So we usually talk about it as a vitamin, but it is a hormone. And they noted low vitamin D in their patients with lipedema, 85%. And in the literature, it's a pretty high incidence of low vitamin D with patients with lipedema also. But this was quite high. And they said that there's several symptoms of low vitamin D that could accentuate or be implicated in lipedema. And one is pain, and the other is fatigue. So they say that, you really should be assessing your patients for vitamin D. And then the last one they talked about is insulin-like growth factor. It's called also IGF-1. And this is a hormone that you have naturally in your blood, and it really directs your growth hormone. And it seems to be correlated with your levels of this are related to what stage of lipedema you have. And other researchers have talked about how IGF-1 may be implicated in the pathogenesis of lipedema. So they said this is important to also be looking at IGF-1. So in conclusion, in this paper, they were saying that every patient with lipedema should be evaluated from an endocrine and metabolic point of view. This is going to be really important, not only to the pathophysiological condition of them, but also how we can best direct treatment. Is it going to be pharmacological? Is it going to be nutritional? Is it going to be, what treatments are going to be best for this person depending on what that endocrine metabolic profile is. So he said it's pretty much inseparable from the overall management of lipedema. So really important. And so again, this was not a study. It was just them presenting what they had noticed in their clinic and some conclusions that they had come to. But not an intervention study or anything like that. It's their opinion, but expert opinion. So I thought very, very interesting. And I hope you found it interesting as well. I just want to briefly, before I go to some announcements, want to see what people are saying in the chat. And we have Lynn is in the UK. It's been hot for a few days there, yes. And Sandra, sounding a bit like the Regeneration Center hormone-based weight loss here in, and I don't know if I can pronounce the city correctly, Patica. Yes, I think that we're looking at hormones more and more associated with lipedema and how can this help with the treatment. But Sandra, you helped to tell me how to pronounce the city correctly. Hi to you also, Tamara. And Sandra also says, I've started to have pre-diabetes this last year and keto has helped. So you're taking down inflammation in your tissue, you're possibly giving yourself a more healthy metabolic profile. All these things, we're not sure of the mechanisms, but they sure do seem to help with lipedema symptoms. Becky is here from Oklahoma, and Lynn said she tried keto and gained 5 pounds. And that was something happened in that first week, but a lot of things change as you stay with the diet and having expert coaching with making sure that you're doing it in a way that is healthy for you particularly, and it's also enjoyable for you, can really help. I'm kind of thinking that 1 week may not have been a long enough test for you, but see what you think is good for you and seek guidance. Marcia says, hello from Texas. And Lynn says, I think cortisol is my problem. I have a very stressful life and a very large abdomen. Yes, it could be. And Lynn also said, would your TSH be normal or elevated if you had autoimmune hypothyroidism? So typically your TSH would be elevated because your TSH is not your thyroid hormone. It is your thyroid stimulating hormone. And so you would get more of that hormone out to tell your body to start shooting out thyroid hormone. So, and when you have some kind of hypothyroidism, you would have that number be high. But I'm not an expert in that. So definitely talk to your healthcare provider about that to be sure. Carol says hi from Maryland. And Tamara, I'm not sure what that means. We have air you could wear. It's humid. Oh, okay. I see you're wearing it because you're sticky on the skin. And that does tend to make you swell more when it's like that. And Lisa's asking if there'll be a transcript. No, but there'll be a replay. This is always saved below. So you can always watch the replay again. And it might, I can't remember, but sometimes I think you can do closed captioning that might be available on the replay. So thank you everybody for making those comments. I just have a couple of announcements for you. One is I'm going to be doing a webinar next week, next Thursday. This is a free webinar on Thursday, August 8th at 6 p.m. Eastern, optimal treatments for lipedema. And it's going to, only be about 60-minute webinar. So I'm not going to go into these treatments in detail, but my hope is that you hear about each of these and it's something you can go to your healthcare provider and ask about. Would this be good for me? Where can you send me so I can try this treatment? Also, if you are a therapist that is providing treatments for people with lipedema, and you're not already doing some of these treatments, it will give you something to investigate that maybe you want to learn how to provide some of these treatments. So these are treatments that I'm going to be discussing. They're in the literature. They've been studied and shown to be effective for lipedema, and others that are more experimental, but anecdotally, we're finding that they're really good for helping with symptoms of lipedema. So join me on Thursday while I talk about all these various treatments that you can try for lipedema. And then for those of you that are trying to get a diagnosis of lipedema, trying to get confirmation that what you think is lipedema actually is, we got something for you, and that is a roadmap for diagnosing lipedema. It's a one-page handout that's front and back. So I guess officially it's 2 pages because it's front and back, but it's very simple. The front page is really meant for the clinician, something that you can hand to your healthcare provider and help them be able to diagnose lipedema, both in yourself and for their other patients. And the back is more like a little questionnaire of questions you can ask yourself and see if you think this is what's happening with you, and very likely that you have lipedema. So down below, there is a link for you to be able to get that handout. I think it takes you to a website, and you have to provide your name and your email address, but then you will get this handout and you can print it out and take it with you to your healthcare provider. This is a distillation of our paper that we published earlier this year. And that's a proposed framework for case definitions of lipedema for research. And so it really outlined what is lipedema and how to diagnose it for research. So to make sure that research studies are really looking at lipedema and not some other conditions. And so for that reason, it's pretty strict. To diagnose lipedema doesn't have to be as strict, but if you meet these criteria, not only could you be a participant in a lipedema study, but also it's pretty sure that you have lipedema because you're meeting very strict criteria. So you can even check out our whole paper if you wish, but this handout is a distillation of that paper and a bit easier to read. So, and then the last thing I would like to really encourage you to do is to register for our heart-to-heart virtual event that's coming up September 27, 28, 29. Right now, we're having an incredible early bird discount, 75% discount for this 3-day event, happening all virtually. So from the comfort of your own home, you can attend this conference and not only listen to wonderful presentations, but it's very interactive. And you can interact with as much as you want or as little as you want with other attendees, with the speakers, other experts, with our sponsors. This is, it's meant to be a way to interact with the whole community if you so wish. And for an increase in price, you can actually get the premium access, which means you can get the replays and a bunch of other fun stuff. So consider getting premium access and allowing yourself to be able to watch the presentations over and over, or watch ones that you might have missed because you couldn't do 3 days of sitting in front of your computer. So the link is below. Check that out. I think I covered everything. Oh boy, but there's some more comments on here. Becky says she's printed out our one pager. Oh, and she couldn't get it to work, but she'll try it again. Okay. We'll make sure that you get that. Also email me, Becky, if you can't get it, and I can send it to you by email. And remember, that is Leslyn@lipedemaproject.org. And let's see. Lynn says the UK seems to be a bit behind in recognizing and treating lipedema cases. But I tell you, you've got some wonderful groups over there advocating for you in the UK. So you've got some really wonderful people. And plus, they have a lipedema training program for therapists to specifically not just treat lymphedema, but also treat lipedema. Some great stuff happening there in the UK. And Patsy says she's already signed up, and we look forward to seeing you there at the Heart to Heart event. And Becky says she has stage 3 lymphedema, I'm assuming along with your lipedema, and you have MS also. So, you know, a lot of these conditions tend to go together. This is, you know, when you are having difficulty with your metabolism and with your endocrine system, it can affect multiple things and give you multiple conditions. And when you fix that underlying endocrine and, you know, hormonal stuff and the metabolism, then you can potentially fix a lot of stuff that's going on. So I think that is everything. It's been wonderful hanging out with you as usual on the first and third Thursday of the month, talking about various papers of relevance to lipedema. And I will see you again next time in a couple weeks.